This is where it's nice to learn from other people and the data supporting it, that there's not that many chronic infections that lead to dyspareunia, to painful sex. So even gonorrhea and chlamydia, the majority of time are asymptomatic. Now, obviously, if somebody has PID, they have, cervical motion tenderness and leukorrhea and abdominal pain. That's a different story. But most infections, when we think of the kind of, in the literature, kind of the differential, chronic infections are not one that are usually at the top of my mind when someone has pain with sex. But it's different practice patterns. Let's do one last question and then we'll move on to the next lecture.
Nhưng mà cứ mỗi lần quan hệ xong thì là kiểu uất kiểu dặn, và bệnh nhân đã được soi bàng quang cấy dịch niệu đạo nhiều lần, kết quả âm tính, thì trong trường hợp của mình là
Yeah, so this idea that someone has pain when they pee afterwards, it's not a urinary tract infection, right? We assume it's a urinary tract infection. It's probably, honestly, just irritation of the urethra. So I don't know this person's exact story, but the urethral tissue is actually very hormone sensitive. So for that patient, I would be giving them topical estrogen if possible. And if they were on a birth control, it may be contributing as well. And again, I don't want people to get pregnant if they don't want to be pregnant. I'm not here to tell you to get rid of birth control. Birth control is very important. But it may be sometimes we want to switch or give somebody some hormones, because that would be my first guess for that patient.
thực tế thì em cũng đã điều trị cả estrogen và testosterone có cải thiện không hết hoàn toàn. Và em đã bắt đầu điều trị testosterone và estrogen 3 tháng rồi, và bệnh nhân cũng sợ cứ mỗi lần quan hệ với chồng là sợ, không quan hệ xong thì là triệu chứng có cải thiện nhưng chưa hết hoàn toàn.
That's so unfortunate. The other thing I would think of, again, you probably thought of all of these because you guys, know your material very well, would be to think about things that decrease friction during intercourse. So a really good lubricant, because again, it sounds to me more like a friction problem too. It's not, the hormones aren't making it better, what can we do to decrease friction? And then it may be that she needs a little bit, again, I guess you guys don't have topical lidocaine. Just thinking about like a little bit of a numbing medicine, like afterwards she just puts a little bit of numbing medicine on and then goes pee. I'm just trying to think of creative things in the absence of being able to examine her to see, because I can imagine that's very frustrating. The psychiatrist is going to talk to the psychiatrist.
I usually also discuss how they have intercourse, which positions they like, because sometimes if they change the position when we have intercourse, that might change it because there's going to be less friction on the urethral opening. And if she's really aroused, because sometimes she might not be really aroused when she has sex. I think if they, basically, I think from the behind, if they like spoon up, but we can maybe discuss that tomorrow when we talk about cases.
Yeah.
Because very often the missionary position will maybe put a lot of irritation on her urethral opening.
Great. All right, let's move on to the next one. Thank you so much for all your questions. I really love the conversation. Okay, so we're going to talk now about